If you're a parent who depends on a government-funded free dental program for your kids, you may want to call up your dentist before your next visit. The additional cost of personal protective equipment means some of them, many of which are small business owners, can no longer afford to accept patients under this program. Posted in a Facebook page, a dentist reportedly told the parents of a 4-year-old that they are no longer accepting payments under the government-funded Healthy Smiles program, where kids under 17 in low-income families get dental services at no cost. The reason the dentist gave, that the cost of PPE was over $70, a unique challenge the Ontario Dental Association says their members have been faced with, paying for and accessing PPEs on their own.
One always thinks, I've gone to my dentist for a long time. I always see them wearing masks. I always see them wearing eye protection. So what's the difference now? When you talk about the PPE involved, it's the beefed up PPE. It's the N95 masks, the gowns, the face shields.
In that same Facebook thread, the owner of a dental office wrote that with the cost of PPE, they too are no longer accepting patients under the program because they would, quote, have to pay $40 to $60 per patient out of pocket. Dr. Stevenson says this is compounding a challenge that existed even before the pandemic. He says the HSO program is underfunded, meaning dentists barely made any money from accepting patients under the program to begin with. So now they'd be in the red.
There's going to be additional challenges in treating people on these programs. We have advocated to the government to get priority access to PPE, specifically for people to treat patients under these programs.
The province says while those enrolled in the Healthy Smiles Ontario program are entitled to access dental services, participating is optional for dental providers. The Ministry of Health adds that it is aware of recent issues and currently reviewing the new PPE codes in the context of provincial dental programs, including Healthy Smiles Ontario for children and youth and the Ontario Seniors Dental Care Program for seniors. Dentists are having to operate in a whole new world, incorporating safety measures in light of the pandemic, limiting the number of patients inside offices, for instance, while prioritizing emergencies. But Stevenson says patients should always be warned of changes, including new costs, before the appointment.
There's an appropriate way to do that should be discussed with the patient openly, upfront. No one likes sticker shock. Nobody likes sticker shock.
Last year, the province says 8,000 out of the 9,000 dentists in Ontario were accepting patients under this HSO program. With the pandemic here now, it's unclear what that number is. For City News, I'm Faiza Amin.